Hey everyone, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice devoted to helping those who suffer from chronic pain to live painless or pain-free. And certainly we're using holistic and integrative practices to be able to thrive in life. Today we have a really special guest. It's our focus today is not so much on chronic pain because truthfully, many people with chronic pain have other illnesses and medical things that need to be taken care of. So we have a wonderful, wonderful doctor based in Atlanta, Dr. Michelle Cooke. I'm going to let her introduce herself and what she does.
Well, thank you so much for that introduction, Dr. Ruth. I'm really excited to be with you today. So yes, I am a primary care physician. I'm based here in Atlanta, Georgia, and I've opened a practice called Soul Direct Primary Care. Soul is spelled S-O-L, and that is a Spanish word for sun. And there's a lot of reasons behind I chose that word for my practice. One of the biggest ones is that I was a Spanish major in college, and so I speak a lot of Spanish. I hesitate to call myself fluent, but I'm pretty conversational. Also, I believe in the healing power of the sun. You know, it touches everyone. It warms our earth. It has such healing properties. And as a child, my father always called me Sunshine Face, so it kind of brings a lot together for me. So the name is very, very deeply personal.
Oh, that is so sweet. I love that. Okay, Sunshine. There you go. And now I know your other name.
I would love how yellow those tonight.
Oh, okay, very good. Yeah, so you mentioned it's a direct primary care, and that is different from a regular primary care in what way? What is the difference?
Absolutely. No, thank you for that question. And I think it's really the most important question that really gets down to one of the most wonderful things about this practice. So primary care is primary care. And what we found nowadays, that primary care really isn't serving patients the way that it used to. Primary care used to be about the relationship between the doctor and the patient. Usually there was a neighborhood doc. Everybody knew who that doctor was. They lived, they worked in the community. And they were a community leader, and they were the healer of the community. But unfortunately, I feel like we've gotten to a place where that has very much been perverted. And I feel it's been perverted, unfortunately, by the interference of third parties, such as corporate institutions and even insurance institutions, who have really hurt the relationship between the doctor and the patient. Today, more than ever, we're seeing an epidemic of physician burnout. And it's also coupled by a new epidemic we're recognizing called patient burnout. So on both sides, patients and physicians have been so frustrated with encountering a system called medicine. It was not always like that. Medicine used to be a place of healing, and direct primary care brings it back to that. So direct primary care means that the patient contracts directly with their doctor. No third parties, no corporations, no insurance companies. The patient pays their doctor directly to receive the services. So in direct primary care, what most practices do is something called a subscription or a membership fee. And it's a periodic fee that patients pay to maintain that relationship with their physician. So at my practice, my patients pay a monthly membership fee, and it's all inclusive of their care. And to me, I feel like this is where the magic of direct primary care happens. So my patients pay me a monthly membership fee, and with that membership fee, all of their services are included. They're not paying a copay. They don't have to meet their deductible. They're not getting surprise little bills in the back end. It's a flat monthly membership fee. They can come to see me as much as they like. They can call me as much as they like. They can text me as much as they like. So what's nice is that the patient doesn't always have to come into the practice to receive care. A lot of that care is done through telehealth. People are busy nowadays, and we have these beautiful things, these phones, these computers, where we can get in touch with people without having to be face-to-face. So while I very much value that face-to-face connection, it's so convenient for my patients to be able to get in touch with me by text or by phone call to handle their medical issues. And that's all encompassing in their membership fee.
Right. And I gather too, as you said, reestablishing that connection. So many times patients come in with a problem and they only have like 5-10 minutes to see their doctor. There's nobody really listening, right? And the doctor guesses their issues or not. Are you someone? I'm assuming you're someone that gives education to people that's important. Yeah.
Oh my gosh.
Who's your ideal patient? Who's your ideal client? Who would you love to see walk in the door? What good reasons do you help people?
Well, I'm going to answer that question, but I want to go back to something you said that I think is really important. And you talked about having time with your physician. And that's one of the biggest things that primary care solves. I like to say that my practice in direct primary care practices in general solve 3 major issues in medicine. One of them is access. The second part is quality and time with your physician. And the third part is price transparency. So let's talk about access. Here in Atlanta, if you call to try to get an appointment with a primary care physician, it could be 3, 4, 5, sometimes 6 months before you can get an appointment. If for a routine physical, those are considered low priority. Some people are waiting upwards of a year to see a doctor. That's not access. You may have insurance, but if you can't get to your doctor or get services, your insurance is worthless. The second thing is quality and time. Most people, as you mentioned, only get about 15 minutes for their appointment. That's not the time they really get much of anything done. And that's really door to door. Like from the moment you get into the moment you get a 15-minute visit, which doesn't allow us the quality time to get things done. If you ask any physician, we're all taught in medical school training that the most important of the patient encounter is the history, more than any test, more than any physical exam finding, more than anything else. And that means time that you talk to your patient. And as a physician, when I worked in the old system, I was so frustrated by having that one tool, the most important tool, which is the ability to talk to my patient, taken away from me. And that's where I decided I could no longer work in a system that took away the most precious, important thing about a doctor-patient relationship is that time to speak with each other. So in this practice, when my patients come in, all of my appointments are a minimum of 30 minutes, but usually that can be 60 to 90 minutes, but that's the time we need to get together. So you talked about education. Finally, we can talk about education. We can really drill down to what the pain points are. We can talk about diet, we can talk about exercise, all those first line things that we should be incorporating before we start putting people on medication. What we find, and the data shows this, is that the shorter the appointment, the more likely the patient's going to get a medication rather than a behavioral health intervention. So if you come in and you're obese or you've got diabetes, before we even talk about what you're eating or how much you're exercising, you're probably going to get a pill if you don't have enough time with your physician. Now, I'm not saying there's not a place for pills, because there absolutely is. Sometimes that's one of our great tools, but it shouldn't be the first tool. It definitely should not be the first tool. And you can look at all the guidelines that supports that. Most of them say start with behavioral interventions, and direct primary care finally allows them to do. So my ideal patient is the patient that wants to talk to their doctor, that wants to get information about how to make their life better with the least amount of medication. So that's really who I'm reaching out to, people that want to try to fix problems, get to the root of the problems, and try to do that with the least amount of medication possible.
That is awesome. I think that's so great. And I think what a lot of people don't realize, like say when they're diagnosed with diabetes, they're not educated about what they should be eating. They're not educated about, exercise, and they get these complications. They've been taking medicine, but they still get complications, and they're avoidable. They're preventable. What people don't recognize is that diabetes does not. You don't have to have amputations. You don't have to lose your sight. You don't have to have neuropathy. Those are complications that could be prevented, and even diabetes can be managed where you don't have it. I mean, if that happens, if you're really doing the things that you need to do as far as lifestyle medicine. Yeah, I think,
and we need to have a system that supports that, right? So when we work in insurance-based and fee-for-service medicine, we're kind of paid by the more we do. You actually, in some ways, can get more money, if you will, by prescribing a medication, because that makes a visit more complex and raises the complexity of the visit. But I think it's much more complex to initiate behavioral change. We know how difficult that is to do, but we're not really reimbursed for that. So we have an incredible misalignment between the way that we're paid in medicine and what really are the outcomes that we need to get there in the patient's interest. So more often, patients are getting more interventions, more testing, more medication. That may help resolve the problem a little bit, but doesn't get to the root issue. So in direct primary care, by cutting out all of that noise, all of the, coding and CPT and ICD, all that stuff that has nothing to do with how you treat a patient, we can really get down to the heart of people's issues and help them live better and healthier.
Yes. Awesome. I love it. And the thing is, most young people don't, they're not thinking about health. They're fine, right? So, do you have recommendations for families, or, how to get what you do for the entire, household? And I love you have Alice Olivia.
Well, tell me about my practice. Every practice runs a bit differently, but many practices do what I do, which is there's age-based pricing. So for my younger folks who may not need as much care, sometimes that's true, sometimes it's not, but for my younger folks who may not need as much care, they have a lower price point where they join my practice at. So they pay a little bit less. And then if you come on as a family, I have some group discounts. I would say the biggest hurdle that my patients struggle with joining the practice is sometimes the pricing. But we have to look at that very differently. Most of my patients that join the practice end up saving money, especially if you're even just a moderate user of healthcare. And how does that happen? Yes, you have this monthly membership fee, but the price is finally transparent. None of us have walked into an urgent care or to an ER or anywhere and saw a price list on the wall. You go in, you get your services, and then you pray. You pray it's not some ridiculous fee that you have to pay, or when you hit your deductible, wherever all those factors are that make payment. But we know that in this country, the number one cause of bankruptcy are medical bills. By treating people, we are causing serious financial harm. And there were many times where I financially harmed my patient because I could not give them accurate information about how much they would pay for my care. So under the system, you know exactly how much you're going to pay. If there's any additional services, you know exactly what those prices are and you can budget for. The second thing is because you don't always have to come in for a visit, how much time and money have I saved you by not having to go to urgent care, by not having to take time off from work, but not having to drive across town to get to my office? You just save so much money that way. So one of my favorite stories, I have a patient who loves to wear earbuds. She had eczema up her ear, and just wearing these buds, it built up the moisture and she can get these infections, but I yell about it all the time. But she does it nevertheless. So she got another ear infection. And so she called the office, or she actually texted me. She's like, Dr. Cooke, my ear's leaking again. Would you mind sending me my antibiotics because it's really bothering? And I said, you know what? No problem. Why? Because I know my patient. I know the problem. I know the treatment, and I took care of it for her. And all of that was included in her monthly membership fee. If she called me again that month for something else, I would have handled it. There would have been no extra charge for her. But when I think about how that would have happened in my previous model, that would have been a huge inconvenience for her. She would have woke up with her ear leaking. She would have called my office. And honestly, I probably wouldn't have had an appointment because I was booked to the brim with patients. They would say, Dr. Cooke can't see you today. You need to go to urgent. So she would have had to miss work or skip work, drive to urgent care, see a physician that didn't know her or some other practitioner that didn't know her to get this antibiotic to go home. And she would have had to pay whatever the fee is for the urgent care in addition to the time that she missed at work. So maybe the urgent care fee was $100, $200, but how much did she lose in wages by not being able to stay at work that day? So when we think about waste a lot of money in medicine, we fix that with direct primary care. We're not going to have you to come into the office if you don't need to. But in the traditional model, the best way to get paid is when the patient walks through the door. So the patient comes through the door, that's how you get paid. So if they have the simplest problem that can be taken care of by phone, we're always incentivized to bring them in.
Yeah.
And we don't have to bring people in for everything. What you need is a consultation with your doctor. And that can happen by telehealth, that can happen by phone call, that can happen by text message. So when people balk about the price, I really want you to think about how much they're truly spending whenever they have an emergency.
Right. I don't know if this is a good question for the audience. I'm just curious as to what your opinion is. A lot of people just think, well, if my insurance doesn't pay for it, oh well, but that's the kind of the attitude. If my insurance pays for it, good, I'll take it. If your insurance doesn't pay for it, and what they don't recognize is sometimes the insurance is wrong. Sometimes there's something that's what bothers me about the system. I really have a thing in my, what do they call it, up your car or whatever, because everyone should be getting what's necessary, right? Everyone, regardless of your insurance, regardless of your status or your socioeconomic place, everyone, if it's what's indicated, that's what you should be getting. And yet we have a system where we don't ask, what do they need? We have to ask, what does their insurance cover? And based on what they cover, we have to work within that. And it may not be the best. It may not be what's indicated. What's indicated might not be available only because their insurance doesn't pay for it. And people don't know this and they don't realize it. And the system is causing more problems than it should. It should be fixing things. So I don't know. What would you say to that patient? It's like, well, you all land that.
I mean, you're preaching to the crowd. I mean, I really hope that by starting with direct primary care, we're going to see other direct lines of services. We're seeing that now. And an example is Mark Cuban has created this cost plus pharmacy. That's probably my biggest pain point. My patients can come see me and they can get what they need. But then if I have to send a script to the pharmacy, now insurance is to dictate how I practice my care. I have a great example, great or horrible, however you want to look at it, from the pain side that I'm sure you dealt with a lot. And a couple of years back, this magical thing came to the market, which was topical NSAIDs or topical anti-inflammatories. And I love them because I have a lot of patients that have chronic arthritis and they're popping Tylenol all day, or they're taking ibuprofen all day, and some of them are getting stomach bleach or too much ibuprofen, or they're on more medication because now they have terrible acid reflux, or they perk their kidneys. But lo and behold, we now have a medication they can rub on their knees and get excellent pain relief without all those side effects. The problem was insurance didn't cover it. So I was actually incentivized in some ways to write opiate prescriptions, to write more anti-inflammatories for patients when there was a better option, but insurance had to decide if they didn't want to cover it. I'm so excited that now we have these things available over the counter. So again, that's a direct system. Here's the price. The patient can choose to pay it if the doctor thinks it's indicated, and the insurance doesn't have a say in. So I do feel there's many places where I've been forced to choose the less helpful, or even sometimes the less healthy option for my patients because of what insurance, because of the roadblocks that insurance put in the way.
Right.
So I'm so excited that we're moving into a place where we're getting more price transparency. Patients deserve it. And by being denied price transparency, and by being denied the ability to follow through on their doctor's orders, patients are facing more and more harm. So yes, a lot of patients say, well, I want my insurance to cover it. And in a perfect world, insurance would cover it. But we are so far from that perfect world. And it feels like every year we're getting further and further away from that, with higher deductibles and more restrictive formularies and more prior authorizations. I mean, it just gets harder and harder to get insurance covered things. Mm-hmm. So I think we need to really remove insurance, especially at these very basic levels. True insurance really should be for catastrophic events. If we think about our car insurance, if we think about our home insurance, if we think about those insurances, they pop in when bad things happen. So if you crash your car, that's when insurance comes in. If your house catches fire, that's when you use your insurance. You don't use it for your oil. You don't use it for your gas. You don't use it, to change the light fixtures in your home. You find it a good price. You negotiate and you look around and see what's available in the market. And that's how you pay for it. You can budget for it. But we don't expect insurance to cover all of that. But by everything, we make everything so much more expensive and less. So let's bring that back. Let's use insurance where it matters. If you need surgery, you have to get rid of
exactly right
stuff.
You're right.
And then we can use, your dollars and your budget to find a quality product for you that fits your budget that your doctor can.
Awesome. Very well said. Thank you. Thank you very much. How can people get in touch with you, especially if they're in Atlanta or in Georgia and they need a primary care doctor?
Absolutely. Well, as of right now, which is September, we are still accepting new patients, but a direct primary care office, we have a limit to how many people we take on because we want to make sure that we always have availability for my patient. I never want someone calling saying they can't see me for a month. I never will allow that to happen in my practice. Like, if you're interested in joining the practice, the easiest way to get in touch with us is looking at our website. We are www.soul-dpc, which is directprimarycare.org. I'll say that again, soul-dpc.org. You can also find us on Facebook at Soul Direct Primary Care and on LinkedIn as well as Instagram. And you can find me as well, Dr. Michelle Cooke, Michelle with 2 L's, Cooke with an E. I had a lot of extra letters in there. And I'm also on all the social media platforms.
Okay. Thank you so very much, Dr. Cooke. This has been really good. I'm sure the audience got some worthwhile things out of it.